more on COVID-19 and China's efforts to contain the virus. I'm joined now by Dr. Peter Chin Hong. He's a professor of medicine and an infectious disease specialist at the University of California, San Francisco. Peter, well, we're talking about Wuhan again, where it all began. Talk to us about what we're seeing in China right now.
I think what we're seeing in China right now in the big picture, Mike, is very low levels of virus. Of course, the government is using testing as a way to control what we're seeing in China. They've had amongst the lowest deaths per capita in the world during the arc of the pandemic. So it's working, but whether or not it could be sustainable, I think it's on the minds of everyone.
Yeah, let's talk about that because the zero COVID policy has just really become a mainstay of China's approach to really trying to strangle the spread of the virus. It has helped to minimize hospitals being overrun. I know you had to deal with that during the pandemic. It's kept death rates low. What do you make of this strategy overall?
I think unfortunately, it's not sustainable. It's not good for people's sense of well-being. It's not as good for the economy as we've seen. I think focusing hopefully on vaccines would be the solution because, testing only is for the now. Vaccines are for the future. And I'm worried because in Chinese elderly populations, only 60% of those over 60 are immunized. And I'm particularly alarmed by the fact that only 20% of those over 80 are immunized. So if you think about the Omicron flavors, they are coded as mild. But as we saw in Hong Kong, even if a mild virus gets into the wrong soil, it can germinate and cause a lot of destruction.
So obviously vaccinations need to be ramped up. What are some policies the government can institute? How can it get done and done quickly?
Well, I think, there need to be more incentives for the elderly in particular, because those are the ones who I'm worried about will go to the hospitals. And not only go to the hospitals, they will do very poorly. So thinking about the early days when there were incentives, maybe not ice cream like in Beijing in the past, but some of the incentives that could encourage the elderly population in particular to get a booster shot, even though there's been high uptake of the first 2 doses, very, very little uptake in boosters. And we know even in the United States during Omicron, the proportion of vaccinated folks over 65 who are dying is increasing, but it's mainly those who've not gotten a single booster.
Yeah. Recently, we did see some vaccine mandate being issued. If you want to go to these places, you got to have the vaccines. Is that another step to really kind of try and get people more incentivized?
I think so. Certainly if uncle or aunt or grandma or grandpa wants to go to their favorite noodle shop and they need to get a vaccine, that would be a great incentive. So food is so important to Chinese people, including myself. I think having an instituted vaccine mandate for events, concerts, etc., would be other steps. And of course, anything where a lot of older folks are going to go to that's important to them, I think that will be very key. I am worried about misinformation as well. In Hong Kong, we know that part of the reason why the elderly population didn't get vaccinated because there was a lot of talk about side effects and so on. So I think the Chinese government needs to really double down on any misinformation around vaccines.